So I'm very proud of the work she's done and her care and concern, and I'm happy that she got recognized for this. So I'm very proud of you.
Thank you. And I wouldn't be anywhere today without you. I can promise you that.
We're here to help honor two of our outstanding members of this team, Teresa Forster and Katie Weary. Teresa and Katie have been honored as well by you as recipients of the 2021 HCA Advocacy Award. Teresa and Katie, congratulations.
Hi, everyone.
Hello.
Hi, my name is Mike Walton. I'm the director of the VSC. I'm here with my team, and we'd like to thank the HCA for this recognition and honor. We truly appreciate the consideration given to the work we do every day to enrich the lives of our senior population.
My father gave me the best advice. He said, you never go to work thinking you deserve a paycheck.
She's always given everything.
Marky brought back the VNS-NY we all knew and loved.
You go to work and you earn that paycheck.
She had the credibility to talk honestly about the places we have been and the work we were going to do.
And every day you find a way to make the people you work with proud.
HCA's annual awards are a sacred tradition. As we pivoted to our first virtual conference last year, HCA made the hard decision to repurpose our annual awards, largely in reverence to this tradition. And at that time, we saw incredible acts of courage. We saw the willingness of home care staff to accept and meet unimaginable challenges caused by COVID-19. These profiles demanded larger witness. And so in 2020, HCA initiated a Home Care Heroes campaign, recognizing over 30 home care aides, nurses, therapists, and operations staff whose deeds reflected the scale and intensity of committed action in the pandemic. Now, 1 year later, we've gained the time and perspective necessary to fulfill what may be the ultimate purpose of today's time-honored occasion, which is to celebrate excellence in home care and hospice through this thoughtful reflection. And so this year, we've also had the opportunity to broaden our award categories to encompass individuals and roles and perspectives that even more fully characterize home and community-based care. This includes our new Patient Shining Light Award for an individual who has confronted medical challenges or circumstances and shined as a source of inspiration for all. HCA thanks our awards committee for their hard work, difficult job selecting from among the many excellent nominations. And we are so proud and honored now to recognize each awardee's achievements, contribution, service, and inspiration, their excellence to all in home care. I'm so pleased and honored to welcome Cynthia Stanley, our Caring Award recipient. Cynthia is a registered nurse for HCR Home Care. During a typical year, Cynthia spends most of her time caring for patients, providing bedside mentorship to other nurses, collaborating with physicians, managing wound care supplies, and educating clinicians. Needless to say, this past year has been one of extraordinary challenge. Since the pandemic began in 2020, Cynthia's role as infection control nurse took on a whole new level of impact and importance. Cynthia suddenly found herself thrust into the forefront of HCR home care as the expert whom so many depended on for answers and direction. She quickly immersed herself in CDC and New York State Health Department guidance to gather the facts. Her many efforts spared countless staff, patients, and families from illness and tragedy. She coordinated a process for ordering personal protective equipment and then calculated burn rates to determine the future need. When there was no other roadmap, she wrote agency policies and procedures to align with CDC and State Health Department guidance for both field and office staff. She monitored HCR's COVID-19 hotline, offered instruction and guidance to staff for COVID-19 positive patients, and managed a dashboard of patients to track COVID-19 illnesses. Patients who were fearful and anxious found reassurance as Cynthia helped them through the recovery process. She provided live and online education sessions for staff on urgent COVID-19 topics, organized and hosted COVID-19 testing clinics for field and office staff. And she extended her expertise to partner organizations that lacked the resources necessary to establish comprehensive infection control practices. These actions not only had a positive impact on the safety of HCR staff, but they also provided much needed protection for patients and their families. Through Cynthia's tireless efforts, HCR Home Care was able to provide uninterrupted service and a high degree of comfort during a very profound time. Cynthia, HCA is so proud to honor you with our Caring Award for your service. And I welcome you now to say a few remarks.
Well, thank you, Al, and thank you to HCA. I'm very honored and I'm very exhausted from listening to all that. When you think back about during this COVID pandemic and all we had to go through back in 2020, it certainly is an exhaustive list of all we've learned and all we've gone through together. I want to thank my boss, Chris Chimenti, for thinking of me for this award. It was very unexpected, but I'm very humbled and honored that he thinks so highly of me. It was wonderful to work with a boss like that. He was my phone a friend during a very critical time. And once again, thankful to the company that I work for, HCR Home Care. I've been here for 21 years, and I've worked with this staff, the field staff and office staff and senior management for years. And I think we all became a lot closer and a lot wiser after all this, after the COVID pandemic crisis last year was said and done. So thank you very much.
Well, thank you for your leadership, your mentorship, and all the caring and compassion that you showed throughout this entire pandemic. As we said, there is no roadmap, and you basically had to take what was in front of you and really guide and lead your agency to a stellar level of service in the pandemic. So our honor is to have you as the recipient of this award, and we're so proud and appreciative of you. Thank you, Cynthia.
Thank you.
I'd like to welcome Wanda Nicholas, who is our Caring Award recipient. Wanda is a home health aide for the Eddy Senior Care PACE program. COVID-19 changed our world in 2000. The virus moved fast and furious. With that intensity came an extreme amount of fear and anxiety. How do we provide services for the people we're called upon to care for? Exceptional home health aides like Wanda Nicholas rose to the occasion at a time of understandable safety fears early on in the emergency. Wanda always demonstrates a calm and professional demeanor. She's unflinching and gladly accepted the assignment of caring for Eddy Senior Care's first COVID positive patient. She did so without hesitation. Wanda was the role model that her colleagues needed in the storm. As time went on, Wanda's peers saw her as a shining example of encouragement to continue providing the best quality care despite the many gripping fears of the pandemic. Wanda consistently demonstrates unparalleled dedication to her PACE participants, stepping forward in so many other ways. In one recent example, she provided 2 12-hour respite shifts on her days off when the participant's caregiver needed surgery, and yet she didn't hesitate. Despite all of the monumental disruptions in our daily lives caused by the COVID-19 pandemic, Wanda was able to maintain perfect attendance throughout the pandemic. She has been a fixture of dependability at a time when so much seems so chaotic. In recognition of her leadership and care, Wanda also achieved level 2 on the Eddie's Home Health Aide Career Ladder program, which is a testament to her advancement as a caring professional. Wanda, on behalf of HCA, thank you for being such an inspiration to others, to your peers, and to us. Please take a moment to say a few words.
I would like to say thank you. At the beginning, I was scared because I didn't know what to do after I was done with work and how I'm gonna be able to go home and caring for my family. And thanks God, everything went well. And I was happy to help because it wasn't easy. Like everybody said, it's a scary moment, but I did it. A lot of us did it. And so I'm glad today because you recognize that. And like my daughter said, I should be proud of myself. Thank you.
Thank you, Wanda, really for the incredible leadership and service that you've provided to all. You're a leader and such a beautiful person. Thank you so much.
You're welcome.
HCA's Quality Award is presented to UR Medicine Home Care in recognition of its pioneering critical illness recovery program. In 2020, UR Medicine Home Care worked with its hospital system to develop an innovative transition of care model for patients recovering from critical illness due to COVID-19. The program seeks to eliminate care barriers by bringing interventions to patients in their homes. This includes nursing care, social work, mental health screening, therapy services, pharmacist evaluation, and evaluation by a critical care physician. The program is integrated with telemedicine, providing timely screening and collaborative interventions in the patient's home, and also optimizing the patient's participation and social distancing during the pandemic. One specific goal is to address what's called post-intensive care syndrome, or PICS. This refers to new or worsening physical, cognitive, or mental health impairments that arise after critical illness and persist beyond the acute care hospitalization. PICS affects up to 80% of patients surviving acute respiratory failure in intensive care, including patients recovering from COVID-19. Although the model was created out of necessity, there are opportunities to adapt it to other patient populations and conditions long after the pandemic. This program was quickly brought to fruition by leveraging a pre-existing, strong working relationship with the agency's hospital system. Its collaborative focus on care transitions using an interdisciplinary approach is a hallmark of quality and innovation, preventing hospitalizations and ensuring that patients feel supported throughout their care. This program was featured as part of the 2020 statewide Hospital Home Care Collaborative Initiative as a prototype model for excellence and emulation by hospitals and home care agencies throughout the state. I'm so delighted today to be joined by Christy Fillmore of Strong Memorial Hospital and Bethany Ragu of UR Medicine Home Care, who will be accepting this award on behalf of their team and on behalf of the system. And I invite you to offer some remarks.
Well, thank you, Al. I'm honored to accept this award on behalf of our team that worked to develop this clinical program. It was born at the bedside of a patient who was recovering from COVID in the ICU and was the brainchild of Dr. Anthony Petropoli, who quickly shared with other colleagues, and we were able to work together and build off of a pulmonary rehab program that was already in development pre-COVID. So this has been a really exciting program to quickly lift up with lots of rapid cycles of innovation. We're looking forward now to expanding it to the non-COVID population in mid-May, to some of the non-COVID MICU patients, and also incorporating outpatient therapy as part of this ongoing development of our clinical operations program.
And I'm so proud to accept this on behalf of the entire team. This has truly been a collaboration of many amazing providers, nurses, pharmacists, therapists, social workers, administrators, IT specialists. It's been a very fulfilling experience to be able to work together to be able to make this program come to life. There's been a can-do attitude from the very beginning of everybody who was involved, and I think that was instrumental. This has been truly a collaboration, and I've been so proud to be a part of it and really look forward to the continuation of working together with home care and growing this for this population and potentially others.
Well, thank you so much, and really congratulations on this incredible work. I mean, I have to say that when I first learned of the program, and then of course, after you presented it statewide, I think I trumpeted to anyone that would listen that this is truly a transformative program in medicine. Really, we are just so proud and excited for the trail that you are blazing with the program. So again, our sincerest congratulations, and we're just so proud of all that you've accomplished, and we really look forward to these next phases. Thank you so much.
Thank you.
We are so pleased and honored to present HCA's Quality and Innovation Award to Self-Help's Virtual Senior Center program. The Virtual Senior Center, or VSC, is a platform that has truly met its moment. More than a decade ago, Self-Help Community Services had the foresight to develop this powerful new technology to deliver social experiences and classes in a virtual format to the homebound elderly. Today, the VSC is helping to overcome new and urgent levels of social isolation that have always existed, but are intensified by the COVID-19 pandemic. Once aimed at Self-Help's community alone, the VSC has been expanded. It can now be offered by any organization, community, or group seeking to deliver virtual services to homebound adults, no matter where they live. It does so in a safe, secure, shareable, and scalable model. Independent evaluation finds that the VSC benefits patients on multiple levels. It reduces isolation and loneliness and increases connectedness and self-reported health status. Over 97% of VSC users say their quality of life has improved because they are utilizing this program. The VSC is the embodiment of quality and innovation, using state-of-the-art technologies to bridge the gap and fulfill critical needs on a broad scale. Currently, the VSC is being supported by a major statewide grant from the Mother Cabrini Health Foundation to support its expansion and availability statewide in New York. Representatives of the VSC team are with me today to say a few words, and I now welcome Russ Lusak and Barbarian Fox of Self-Help to say a few words.
Thank you very much, Al. I'm Russ Lusak, Chief Operating Officer at Self-Help Community Services. just wanted to take the time to just say, thank you to the Home Care Association for recognizing the hard work we've done over the past 10 years. And it's been a long haul. It's definitely been a long haul in developing this solution. And what you said, Al, is just so important to self-help. And what we do, core to our mission, is to promote independent living in a way that's dignified for all of our clientele. And the VSC is a personification of that in a virtual environment. And we are so proud of the program, so proud of what we've done. But I'm here just to kind of hand off the award to those that really made it happen. Barbarian Fox is our Vice President of Technology and Business Integration, who led the initiative under the Mother Cabrini Grant to develop the software to be more robust, to allow us to expand, to meet the needs of more people in New York State, to promote that independence and dignity and in their own homes. And we're really proud of it. Michael Qualette is someone that we are working with as a director. Phenomenal job. And what he's done managing the operations there and getting it moving. Barbara Ann and the design work. Our team is absolutely fantastic. I could not be any more proud of what they've achieved, what they've done. And on that note, I'm going to hand it off to Barbara Ann with my deepest appreciation for what you've done for us, for self-help, for the virtual senior center, but most importantly to the most vulnerable who are homebound right now, but have the benefit of participating in live content and giving them good quality of life in their homes. So Barbara Ann, I hand it off to you. Thank you.
Thank you. And I want to start by echoing Russ's sentiment, our appreciation to Mother Cabrini Foundation, but specifically also the Home Care Association of New York for all of the terrific support and collaboration in helping us shape this vision. It has been and continues to be a privilege to be involved in such an initiative, to have had the opportunity to take such an innovative concept and program and be able to expand it, create a sustainable infrastructure service for senior services, to be able to create something that also addresses loneliness for other populations. That the vision, Russ, I wanted to thank you also very much for the continued support, the years of fight that you put behind the vision, and knowing that this can benefit many, many others, even outside of our own organization. And together we made this happen. We brought it out, and now we'll work with the community to expand it even further. But it's been incredible. Our clients have been incredible. Those who made the transition from the older platform to the newer, all of our new clients and new partners have been incredible as well. I do also want to add one last thing and encourage everybody to not just try the virtual senior center, not just talk about it and envision it. Give us a call, check out the website, but also take a look at our regular website, selfhelp.net, and all the other programs that we offer. It is just such an incredible organization, and it really has been my privilege to be a part of it, to lead the portion that I do, but to collaborate with all the other folks in the program to make this happen. So thank you so much.
Well, thank you, Barbara Ann and Russ. Your work is really inspiring transformative care for individuals who are homebound, isolated, and really for the system overall. And really, you're to be so commended. It's just our honor to honor you. Again, thank you for all the amazing work you're doing, Barbara Ann, Russell, Stuart Kaplan, Michael Qualette, and your entire team. Thank you so much.
Thank you, Al.
Thank you, Al.
It's my honor to welcome Dr. Amy Ehrlich as HCA's Physician Champion recipient. Dr. Ehrlich is the medical director of Montefiore Home Care. A hands-on medical director, Dr. Ehrlich is intricately involved in Montefiore Home Care's day-to-day operations. She's a strong advocate who truly understands where home care fits into the entire medical network. Dr. Ehrlich especially appreciates home care's role in transitions of care, building critical bridges with physicians, home care providers, ambulatory care, and other stakeholders to reduce readmissions and achieve excellence in quality of care. Nothing is too small nor too big for Dr. Ehrlich, whether it's calling a peer physician and getting orders signed timely, or running very complex case conferences throughout the network. She never takes her eye off what is most important, the care of the patient and his or her family. Dr. Ehrlich has provided countless hours of ongoing education for Montefiore home care clinicians on disease processes, clinical pathways, specialty programs, and most recently, the coronavirus. This year, Dr. Ehrlich's wisdom and commitment to home care were put to the greatest test in this pandemic. She helped establish infection control policies, provided education on personal protective equipment requirements to make sure home care workers were protected, and she worked to align home care processes with a hospital to help care for patients post-discharge. Through Dr. Ehrlich's leadership, Montefiore developed a post-acute COVID-19 rehab program that has helped more than 300 patients who were sent home from hospital with oxygen. Dr. Ehrlich's knowledge and support have contributed to a high vaccination rate among staff. She always makes herself available to answer staff questions about getting the vaccine and has been instrumental in Montefiore's initiative to vaccinate home care patients. Dr. Ehrlich, we're so honored to present you with this award, and we invite you to share remarks as we celebrate you, an outstanding physician champion for home care.
Thank you. I'm really honored to be the recipient of this award, particularly in such a challenging year. And I really accept this reward on behalf of our agency, the leadership, and the staff that have been out in the field throughout the Bronx. It's kind of hard to step back and think about what happened a year ago when the pandemic hit. We were the epicenter. It was in our community before we even knew about it. We were faced with transforming our entire network. Our clinical staff became ill themselves. They were part of the community. They were helping support the hospitals, and they were out there every day in their PPE taking care of our patients. We were truly in the community. The entire staff was here in the Bronx day after day, trying to take care of our patients and help the hospitals as we needed to discharge these patients. I feel humbled to accept the award because it really was the entire team of not just the clinical team, the administrative team, the clerical staff. They were all in here together so that we could provide care for our community and to support our hospital during really the most challenging period that I think we'll ever live through our life. So I'm glad we're all here, and I really am very deeply grateful to accept the award on behalf of Montefiore Healthcare. Thank you so much for this honor.
Well, thank you so much, Dr. Ehrlich. You know, on a day-to-day basis, the immense work that you do, let alone in crisis, requires such great leadership, and your leadership is truly extraordinary. And we're so honored to honor you as our outstanding New York State physician champion. Thank you, Dr. Ehrlich.
Thank you.
Thank you, Amy.
Thank you.
Best wishes and gratitude.
Thank you. Thank you, Mary, for this great honor. Thank you, everybody.
Thank you. HCA is so honored and has the distinct privilege of presenting our inaugural Shining Light Award to Jillian Tebow. HCA first had the opportunity to work with Jillian 2 years ago when the national organization Sepsis Alliance selected HCA to develop an informational video about sepsis and home health care. The VNA of Albany had recommended that Jillian be a part of the video, speaking from her perspective as a sepsis survivor and a home care patient at the VNA. Jillian not only had an important story to tell, but it became immediately evident to HCA that she possessed a uniquely powerful voice, making her an exceptional patient advocate. and she soon asked to further work with us in any and all ways on behalf of sepsis prevention, education, and care. Jillian began to experience chronic bouts of sepsis because of a severe medical condition affecting her digestive functions, gastroparesis, that requires daily infusions of intravenous nutrition and a central venous access point that presents a constant risk of infection. Infection-induced sepsis has brought Jillian to the hospital many times for urgent medical care for broad-spectrum antibiotics and IV fluids, which are necessary to fight sepsis. While the VNA regularly screens Jillian for sepsis prevention and early identification, Jillian has, most importantly, learned to self-observe for symptoms. She has also learned that it takes determination and assertiveness to immediately reach out for the kinds of services or interventions that her own experiences tell her are necessary. In the past 2 years, Jillian has volunteered her voice, experience, and wisdom whenever called upon by HCA or others to help raise awareness among the public, elected officials, and the healthcare community about a condition that remains fundamentally misunderstood, despite the fact that sepsis causes more deaths than cancer, occurs more commonly than heart attack, and ranks as the most expensive medical condition nationwide. In September 2019, Jillian traveled to New York City to join HCA at the Sepsis Alliance National Sepsis Hero Recognition Ceremony, taking the stage with us as an inspiration in her battles against sepsis. That October, Jillian joined HCA again in preparing a seminar to inform state legislators and their staff about sepsis and the need for action steps to address it. She is now a consumer advisor on a major new 2021 phase of HCA's Stop Sepsis at Home initiative, helping us to advance new groundbreaking work in sepsis through home care and across the continuum, including in pediatrics. As a spokesperson, Jillian is continuously sought after to address state and national audiences, including a recent social media broadcast hosted by the New York State Office for Aging in commemoration of Sepsis Survivors Week in February 2021. She has also recently lent her voice to Sepsis Alliance for a national initiative to educate about the risks of antimicrobial resistance and the steps people can take to end superbugs. Jillian, we are continuously amazed by your dedication to the cause of sepsis, how generous you are with your time, and your openness to share the insights gained from your personal story to help others. Would you please take a moment to say a few words?
First off, I would just like to say I appreciate being invited into this, and I'm incredibly humbled by this award. You know, nobody expects to get sick when they're at a young age, but you know, time is time, and it sometimes is inevitable, and that was my case, and it turned my life upside down, and I have been dealing with it for so long now, and you know, given all the sepsis episodes and hospitalizations, I'm so incredibly happy that I have, you know, learned so much from it. And you know, there's lack of information out there, and if I can help one person, that's just priceless to me. Advocating is amazing, and you know, this is my entire life of dealing with chronic illness. I feel like I've had a void to fill, and this is very much it. And you know, gives me a sense of accomplishment, and makes everything that I've gone through extremely worth it. So I'm just extremely thankful.
Well, we can't commend you enough for all that you've done, and all that you continue to do in working with us. You are in meetings with us regularly now, and we're really looking forward to everything that's ahead in 2021 with this major project. I also would just want to say that the first time that we met was just ahead of your interview for that video. And I remember sitting at the table, and the inspiration that you conveyed was just overwhelming, was awesome and overwhelming, and it really left an indelible mark on all of us. So we're honored to work with you.
I'm so appreciative. I mean, that's all I ask for.
Thanks and congratulations from all of our membership, and our thanks to you, Jillian.
Thank you so much. I appreciate it incredibly.
HCA is honored to present our 2021 Advocacy Award to Teresa Forster and Katie Wary, recognizing their unparalleled advocacy for hospice and palliative care in support of our state association and membership, and of providers, staff, and patients across the country. Teresa Forster is Vice President for Hospice Policy and Programs at the National Association for Home Care and Hospice, NAC. She coordinates the organization's legislative, regulatory, and program efforts on behalf of hospice providers. She has been at NAC since 1996 and previously served as Director of the Special Committee on Aging of the United States Senate. In that capacity, she directed committee efforts to investigate concerns related to the senior citizens of the nation. Katie Wary is the Director of Home Health and Hospice Regulatory Affairs for NAC. She has over 30 years of experience in home health and hospice, holding several executive level positions. Katie has extensive and direct knowledge of industry operations, regulation, accreditation standards, interpretation and compliance, quality assessment, and performance improvement programming and compliance programs. Teresa and Katie combine to provide a 1-2 combination of policy and program advocacy that addresses virtually all areas and levels. They provide direct support for hospice and palliative care providers, as well as proactive planning of initiatives and innovations for hospice and palliative care advancement. They engage with Congress and the federal administration on all things hospice and palliative care, including urgent matters of both positive opportunity and critical reshaping of policies. They are nationwide educational leaders promoting hospice and palliative care awareness, utilization, clinical and program best practices, and advancement in quality of care and access. Teresa and Katie work directly in support of HCA and our New York hospice and palliative care members to provide vital information and to garner input to the national level. I'm not sure that a single day goes by without HCA seeking their hospice counsel, guidance, and advocacy. It's with such great pride and appreciation that HCA bestows this high award and recognition upon these two great champions of hospice and palliative care. And Teresa and Katie, we welcome your words for our membership.
Al, thank you so much. It's such a tremendous honor to receive this award. I have to say that the work that I've done in hospice has been really by far the most rewarding work of my career. And it's because I have had the opportunity to get a very good sense of how the work that I do can impact patients, their family members, and providers, really, right at the ground level. And I can't say that has been the case with all the work that I've done in my life. So there's a tremendous amount, it's tremendously rewarding. I also want to say that, there's nothing like working in teams, and the work that we do is, we are so interdependent on one another and on bouncing things off of one another, and also with our state association partners. And there is no association that outranks you guys in terms of your willingness to collaborate and work with folks at the national level, and the level of interest and engagement that you have around these issues. And so it really is just tremendously rewarding to come to work every day and to know that we're going to have the opportunity to work on the issues we do and with the people that we do. And For that reason, it's great to be recognized, but it's even greater just to have the honor of actually doing the work that we do. So, but thank you all so much, very much. Thanks.
Teresa, thank you. Katie?
And thank you very much. I echo everything that Teresa said. It's a true honor to receive the award, especially from an organization such as HCA. As Teresa said, it really does take a team. She and I are so interdependent on what we do every single day, but that does include Al, Pat, the whole rest of the team, and your members. And it's very, very rewarding to see not just that you're advocating and you're working on the regulatory side, but that you're always remembering the core reasons for hospice and palliative care. I got involved in hospice actually as a volunteer in college due to a personal experience, and I never want that center, that core to go away. And you guys make it so easy to work with you. And I very, very much appreciate the reward and recognition. Thank you.
Well, thank you both. I mean, I can't say enough how remarkable your work has been at the national level and with us and across the states. And I think it really goes totally to the goals that you both just described. Really, it's all about what we're trying to do for individuals that have this, these unbelievable needs, both as individual patients and as families and communities. And truly, the work you do is extraordinary. And I feel that on behalf of HCA, our only distance is our geographic distance. I feel that we are so close in the work that we do with you. And again, so appreciative of everything. It's such an honor to honor you. And we thank you again so much and congratulations.
Thank you.
And now for HCA's most special Ruth F. Wilson Award. On January 31st, 2021, after nearly 4 decades at the Visiting Nurse Service of New York, Marky Flannery concluded her tenure as president and CEO. During her 3 years as CEO, she oversaw one of the largest not-for-profit home and community-based healthcare organizations in the US. On any given day, more than 40,000 New Yorkers are in the care of VNS-NY. In that time, Marky Flannery transformed this iconic organization by positioning it to succeed in the evolving healthcare landscape. Under her leadership, VNS-NY achieved financial stability and solidified its role as an industry leader by transforming the way it operated. Supported by new senior leaders that Marky brought on, she oversaw the development of a new strategic plan and went on to ensure that VNS-NY executed every aspect of that plan, establishing a new care management division that combines remote patient monitoring with targeted in-home interventions, modernizing VNS-NY's IT infrastructure, developing a world-class data analytics team, and so much more. Through her leadership, VNS-NY's clinician training has been enhanced and expanded. Its hospice program has added specialized services for heart failure, COPD, and cancer patients. VNS-NY's large home health aid workforce has been empowered by new smartphone technology and training, and its famed research center has continued to explore new modes of care delivery and gather evidence of their effectiveness. During her time as CEO, Marky Flannery established VNS-NY as a national leader in addressing health disparities, bringing LGBTQ culture competency training to its entire workforce, creating an anti-racism council, a highly rated veterans program, the continued expansion of VNS-NY's community mental health services, and the strengthening of funding and opportunities for VNS-NY's community benefit programs. There is no doubt that Marky Flannery's transformative role at the helm of the organization will have an impact within VNS-NY and across the home care and hospice industry for many years to come. However, Perhaps the most striking and memorable aspect of her leadership occurred last year in her tenure when she oversaw VNS-NY's response to the COVID-19 pandemic, a response widely recognized as setting a standard for the entire industry. Markey has always played a pivotal part of VNS-NY's well-known leadership in responding to crises during her 39-year tenure, from the HIV/AIDS crisis to 9/11 and Superstorm Sandy. As CEO, Markey played an extraordinary hands-on role, working tirelessly to address the needs of New York's most vulnerable residents and ensure the safety of VNS staff, patients, and health plan members. She immediately set up an emergency response team with leaders from across the organization, oversaw the design and dissemination of internal COVID-19 dashboards, led the transition of thousands of employees to an effective remote work environment, assembled an emergency personal protective equipment procurement effort, leveraging government and private resources, and much more. She accomplished all this while keeping a keen watch on the overall quality of care provided to VNS patients, clients, and plan members, the physical and emotional health of its staff, and the financial health of the organization. While overseeing these many different activities, Markey Flannery also maintained a strong personal connection with the entire enterprise by providing direct encouragement and support through a variety of venues. Beloved by her staff and leadership alike, she kept direct lines of communication open and developed multiple avenues for employee interaction and support. Markey, we at HCA have long been inspired by your energetic, prolific, and visionary leadership at VNS-NY. Over many years, you provided us with wise counsel and expertise on countless emerging issues in the field, and so generously shared groundbreaking insights with your peers across the state and nationally. We are so delighted to honor you today with this award. And most importantly, we thank you for being such an incredible leader for the field. Markey, I invite you to offer remarks to the HCA membership.
Thank you. Thank you so much, Al. I am truly overwhelmed with gratitude at having been selected to receive the Ruth F. Wilson Award. And to be able to be here with you and know that the membership will be seeing this video, I want to thank them as well for their support and friendship over the years. I'm really honored to be able to be recognized in this way by the Home Care Association of New York State. It means so much to me that the work that I'm so passionate about has been recognized. You mentioned my 40 years, and about 40 years ago, I accepted my first position after graduating college, and it was at a home care agency. And I quickly became enamored with the incredible women and men who made it possible for people who wanted to remain at home with outstanding care to do so. And I didn't think I would stay in that field, but I truly fell in love with what these people did. So I worked hard and I had the opportunity to advance in my career, and so honored to be able to end my career as president and CEO of Visiting Nurse Service of New York. So you also mentioned the challenges. You know, there have been many challenges: transit strikes, blackouts, the AIDS crisis, Superstorm Sandy, the horror of 9/11, and then COVID. And COVID clearly was the greatest challenge I have faced in over 40 years. And what I'm most proud of is how we came together as an industry to care for people at home. And then what we did here in New York to share our experience with others across the country so that they didn't have to learn on their own the things that we were able to figure out. So that was something that was really special for me. Again, I'm incredibly appreciative of this recognition, and I want to thank you personally, Al, and your incredible staff at the Home Care Association for this recognition. And again, thank you to my friends, my family, my colleagues, my staff, my industry colleagues too, for their love and support and friendship throughout the years. Thank you.
Marky, it's an honor for the entire association to have the opportunity to honor you today and honor all of the incredible works of your career. You know, you've been an extraordinary leader at every level. And we've talked about so many of the impacts, both in your remarks and in the remarks in the conference of the award. But probably most significant in all of those is all of the thousands of lives that your leadership touched, the clinical excellence and all of the incredible service and compassion that was felt by so many people who may not even know your name. And there is no greater tribute, I think, than that.
Thank you.